we're here with Empowerabilities and the MODDC Council. So we are going to go a little bit over the Olmstead decision and the white papers that the MODDC Council has been working on. So tell me a little bit about yourselves and introduce you with your name and what you do.
Okay, great. Well, thank you so much for having us. We're really excited to be here. So, we are with the Missouri Developmental Disabilities Council. Sometimes we go by MODDC, sometimes you'll hear us referred to as that. I'm Katheryne Staeger-Wilson. I'm a program coordinator with the council. My background is in psychology and criminology with a master's of social work. I've been with the council for almost 9 years now, and I really enjoy the work that we do. It's all about systems change. So I've been in the disability advocacy field for about 30 years, but I'm also a child severe burn survivor, and so I feel like I've been a disability advocate all my life.
Hi, my name is Sangyeal Lee. I'm a DD Council member since 2018, and I'm also a chairman of the Olmstead Sub-Committee, and we've been working on that last couple of years. And I'm originally from South Korea. I live in Springfield the last 26 years.
Okay, that's great. Yeah, so tell me a little bit about the Olmstead Subcommittee that the MODDC Council has formed.
Sure. So do you want to
Go
share?
ahead.
Oh, you want me to? Okay. So the council formed the Olmstead Subcommittee a couple of years ago. And it happened in kind of an interesting way. We were in a council meeting and we were looking at the Missouri state budget, and we noticed that there was a new line item to reconceptualize habilitation centers. And the council wondered what that meant. Because Missouri had done a really good job decreasing the number of people living in institutions. Those are the habilitation centers. The council was really dedicated in decreasing people living in institutions, having people live more independently in the community. So the chairperson at that time decided to create the Olmstead Subcommittee to look into this. And one of the council members was interested in, well, does Missouri have an Olmstead plan? And no one really knew. And we found out that in the year 2000, a long time ago, they did have an Olmstead plan. So the Olmstead Subcommittee reviewed that old plan to see what had happened over the last
25 years?
the last 25 years, to see what had happened, what barriers still existed to people living in the community, and trying to figure out what recommendations would be possible. So the committee did a lot of research. We had a lot of guest speakers come in.
Yes.
Yeah. And we did some surveys to learn more about things, and then kind of summarized all the work in the white paper.
Yeah. So tell me a little bit about what white paper means and a little bit about what the MODDC Council was hoping to get from this research.
Sure. Yeah. So a white paper is typically a short paper, several pages long, that kind of addresses a problem, what the issues are, and then a resolution to that problem. But it's a very complex issue, and it ended up being like 43 pages long, a lot longer than what we thought. And so that's essentially what a white paper means.
Yeah, we tried to put everything into it, so it got longer than anticipated. But we had to put all the information essential information into it. So we decided to go a little bit longer pages than we first planned. And when I became a chairman of the subcommittee a couple of years ago, we started to looking into that all Olmstead plan, and it is very wide. It covers a lot of stuff. So the first time I was really overwhelmed, and but we decided to go one by one, and it took us 2 years to finish that work.
Okay, okay. That's a lot of work then. That takes a lot of time to break that down. Um, so tell me a little bit about what the Olmstead decision is and what that means for Missourians.
Go ahead.
Okay. So the Olmstead decision is actually a U.S. Supreme Court decision. It occurred in 1999, and it was about two women in Georgia, and they both lived in institutions. And they didn't want to live in institutions. And their support team kind of agreed with them. They were like, we don't think you need to live in an institution. We think if you have the proper supports, you can live in the community. And so the two women wanted to do this, and the state of Georgia said no. So they sued the state of Georgia, and the Supreme Court said that if people with disabilities want to live in the community, if they can receive the appropriate supports to live in the community, and it is a reasonable accommodation to live in the community, you have every right to do that. So the Olmstead decision was actually based on the Americans with Disabilities Act. The ADA, sometimes people call it the ADA, it protects people with disabilities against discrimination. That also includes where you live. The Olmstead decision talks about that you have the right to live where you want to live in the community, work there, learn there, enjoy life there in your community.
Yeah, ADA also says that the people with a disability could live least restricted environment, which they refer to LRE, and so that was against to that federal law, and the Supreme Court could declare that they should live in the community, not in the institute. And that's ironic because the Olmstead is actually the last name of the person who said no to it. So that last name became the symbol of the inclusion for Olmstead plan for. So it's kind of funny that way it worked out.
Okay, that makes sense. So tell me a little bit about what the Olmstead plan looks like in Missouri, and does that look different than what it did 25 years ago?
That's a good question. So we believe that Missouri does not have an Olmstead plan currently.
Wow.
Missouri had that first one written in the year 2000. And so that might be something that Missouri considers to really look into developing an Olmstead plan to ensure people with disabilities can live in their community. So the white paper really doesn't replace the actual state Olmstead plan. It's just our work in reviewing it and our recommendations.
Yeah, yeah. Okay, so tell me some of the findings that your white paper covers.
Go
So let's see. So we talk about what is Olmstead, right? A lot of people with disabilities don't know what it is, that they have this right. So we talk about what is Olmstead, what it means, what rights people have, and then we looked into the barriers that are still persisting, keeping people from living in the community. So we looked at what the Missouri experience is. We did surveys, and we included some people's stories about their goal in living in the community, remaining in the community. We looked at barriers like the housing crisis, the direct support professional crisis. Sometimes you refer to it as the DSP crisis. Medicaid issues. I mean, there's a lot in the paper that goes into that, kind of laying out the issues and then recommendations for change.
Okay, yeah, that makes sense. So it sounds like there was a lot to unpack.
Yes.
Oh yes, a lot.
What would you say is some of the biggest takeaways from the white paper that you've been working on?
Go ahead.
I think for me, it was really hearing about while people with disabilities have this right, how difficult it is to live in the community independently. Just the eligibility process to receive services seems really insurmountable to people. And then to keep those services, and then once you are deemed eligible and you work towards that, then you have the direct support professional crisis. So you have a really hard time getting staff, consistent staff, who do a really good job for you to support you living in the community. I think that was my big takeaway.
That makes sense, yeah.
Yeah, it is very, very difficult to find a really reliable staff nowadays, and the turnover for that direct support staff are really, really big. So we were discussing about how to prevent, and so we were putting into some recommendations and stuff like that on the white paper.
Okay. What were some of the recommendations that you put into the white paper?
For the direct support professional crisis?
Yeah.
Well, one is advocating with legislators, letting them know about it, people sharing their stories about how difficult it is, how important it is for people to know that the pay is not very high for people who do the direct support professional work. That's definitely a barrier, and I think that keeps people from staying on the job because they can a lot of times find jobs, better jobs, better pay, providing benefits to people who work as DSPs. I think that's another issue and why they leave so often, because they don't have health, medical. Yeah.
Right.
Yeah, that makes sense. So as far as the Olmstead Act and the is it considered an act? I can't remember.
Olmstead decision.
Okay,
Right.
Olmstead decision. Can you explain why it's considered such a landmark case and what makes it so significant for people with disabilities now?
So I think because it's based on the Americans with Disabilities Act, or the ADA, it really protects people for their right to live in the community, to live, learn, go to school, work, recreate, enjoy life in the community. And it really kind of set up, I think, the need for home and community-based services. Sometimes you'll hear people refer to it as HCBS. Those are the services that really support people in living in the community. That is an optional service under Medicaid that people can receive so that they can be supported to live independently in the community.
Yeah, before the LRE kicks into the Americans that thought we have a segregation, to have the different separation, and it is the best for them. But now the concept changes that inclusion is more important, and people with a disability could live in the same environment with or without a disability. So we are the community with the whole as the we have to see the benefits of the people with the disability live together, and that's the main goal of the Olmstead decision.
Yeah. Um, so, so a little bit about home and community-based services. How, how often do people rely on those services connect, and how does that, I know you covered it briefly, but how does that connect with the Olmstead decision?
I don't know that I have much more to add on that.
That's
I'm
okay.
so sorry.
No, that's all right.
But I do believe that the HCBS services is really what helps people live in their community.
Yeah.
So let's say that a person needs help with bathing and dressing. Instead of living in an institution or a nursing home, if they can get that HCBS service in their own home, if they have staff to support them to do that and get them ready for the day, then they can go out in the community and work, right? So if they have that HCBS service, that really helps them live the dream, so to say.
Yeah.
Yeah.
Yeah. So how do you think that the Olmstead decision affects people's quality of life? As far as people with disabilities, like on a I wouldn't say day-to-day basis, but maybe like their overall quality of life.
And that's like when you think somebody is in the like facility, living in the facility or living in the community. Those two things are the basically the baseline for the Olmstead decision. So. How about you? Do you think you'll be happy in living in the facility or in the community? Is so or the people without disability, do you like to live in the prison or outside? You know what I mean? Yeah.
Yes.
So that's like a day and night comparison, and I think the quality of life. I believe the quality of life and overall it will be better in if we have the right settings for it. Outside with the community is a lot better.
Yeah, that makes sense. Yeah, I I think I had a few questions about some of the challenges facing people with disabilities right now. What would you say are some of the biggest challenges as far as Missourians go who um, who want to live independently, and how what are some of those challenges that maybe are mentioned in the white papers that you've been working so hard on?
Yeah. So I think right now the big challenge is Medicaid. Right now, there's kind of a process of change to make Medicaid better. It's called the Access Rule, and it's going to be structuring a way to make Medicaid better. And so that is initially addressed in the paper. That process is kind of ongoing right now. What's going to happen, we think, is that there'll be two main advisory groups that look at the quality of Medicaid and how easy it is to access and keep. So the two groups are referred to as the MAC and the BAC. The MAC stands for Medical Advisory Committee. That group is made up of doctors and professionals, and they will be taking a look at making recommendations for change. And then the BAC stands for the Beneficiary Advisory Committee, and that will be made up of people with disabilities, family members, and caretakers.
Right.
And the MAC will have to have 25% of its membership from the back. So a quarter of the people on the MAC will be from the back.
Yes.
So people with disabilities, their family members, and caretakers should be really well represented because they're going to have two ways to provide input to make Medicaid better and stronger.
Okay. That's good to know.
Yeah.
And so as far as people with disabilities, how can they get involved and advocate for change that they want to see, or how can they get involved with the work that MODDC is working so hard with?
Sure. Do you want to? Okay. So if people are interested in advising on Medicaid, MoHealthNet is what Medicaid is referred to here in Missouri. So they should watch on how they can apply to be on the back, the Beneficiary Advisory Committee. But for MODDC, we would love people to check out our website. If they want to use the white paper, they can put in the search bar Olmstead White Paper and have that pop up. We provide it in both English and Spanish. If people want to get involved with MODDC, also on our website, they can sign up for our e-news. There's a place there where they can connect with us in that way, and then always they can follow us on our social media.
Okay.
And now the white paper is only 2 languages, but I'm actually working on the translating into Korean, and well, in the future we'll have more multiple languages available.
That will be very helpful. Yeah. And is there anything as far as what you wish people would know more about the Olmstead decision or the white papers, or anything regarding disability related issues here in Missouri at the moment?
Go ahead.
I would say I want people to know that we really worked on the white paper to be usable. It is long. It is written in plain language on a 5th grade reading level. And then we designed it also by color. So all of the headers of the main topics are in navy blue. So if you're interested in the housing crisis, you can scroll through and find that navy blue header on the housing crisis, and then it talks about it, and then it follows up with recommendations. So if you are wanting to advocate on behalf of housing, you could just print out those couple of pages, and it's essentially your talking points.
Right.
We also have green headers that are video highlights. So if you want to watch a video about the topic, you can do that. We have purple headers that include advocacy tools on some of the topics. And then the orange headers are also specific to data on those issues and family stories.
Yep.
Okay. That's great. I love the color coding. That makes it way easier to go through.
Right.
Yeah. If you'd like to get involved, please feel free to reach out to Empower Abilities or the MODD Council, and please feel free to follow us or continue subscribing, and we will leave it there.